It's been 9 weeks now since the first coronavirus case was recorded in sub-Saharan Africa and 11 weeks since the first case for the whole continent of Africa. And at the Tony Blair Institute, we have repurposed the work that we do across Africa to support governments to respond to coronavirus and the health and public emergencies that have arisen as a result, including an impending economic crisis. We have about 100 staff working to support governments right across the continent, and they're now working in a range of different departments and centres across government. And we're also publishing the advice that we're providing to governments in cases of use to others who we're not working directly with or other developing countries, as well as obviously contributing to sort of the body of knowledge and evidence that can exist as this sort of unprecedented crisis evolves and we learn more about how best to respond. In West Africa, in the Gambia, we've recently just helped advise the government on the distribution of essential food supplies to vulnerable groups. In Sierra Leone, we're working daily with the National COVID Coordinator, who's the Minister of Defence there, most recently looking at the options for lockdown and harder social distancing restrictions. And once the government decided on a very temporary 3-day lockdown, our team there on the ground have helped advise on how to make the best use of that lockdown to enhance contact tracing and testing to try and catch up with the transmission that's happening in the country there. In Nigeria, we've been working for a number of years in the Nigerian Centres of Disease Control. We've been supporting through the NCDC the public communications across Nigeria, but also the restructuring of the Emergency Operations Centre that's managing this crisis across a country of 200 million people. In Ghana, we're working with the President's Health Advisor and the National COVID Coordinator of providing direct inputs into the President's national addresses, for example, and helping support the work that those advisors to the President and government are undertaking to devise the strategy for Ghana as they go forward, having recently chosen to ease their lockdown in favour of sort of balancing out the economic and social impacts on their population. In Niger, we're actually advising the government remotely. We have been in talks with the government there for a long time, but don't have people on the ground. And now, with airports closed and airlines not operating, we're providing advice remotely through the Presidency and Prime Minister's office, and have recently, for example, helped redirect very scarce resources in Niger to ensure that they were focused on procuring really essential supplies. So in addition to things like ventilators, which are obviously in short supply right across Africa, but they also focused on bringing in the PPE needed to protect health workers who are obviously at the front line of this. In Burkina Faso, we've got a team working on the ground there, particularly with the Prime Minister's office, and we, in partnership with the Bill and Melinda Gates Foundation, are now working to overhaul the national call centre there where people are dialing in. It's an important place to provide information to the public, but also an important source of information about what's happening, getting a sense of calls coming in from particular communities, obviously being an alert that there may be transmission taking place there and the contact tracing and testing teams needing to be sent out. We've also been working in the projects that we've got out in East Africa and in Ethiopia, for example. We've supported the government's efforts to repurpose their existing manufacturing capacity to focus on the manufacturing of PPE and other essential supplies such as hand sanitizer, which is supporting the government's public health response to the coronavirus crisis. We've also, in partnership with a digital market research company, just started undertaking some public surveys in Ghana, Kenya and Nigeria to add to the body of information available to governments for policymaking purposes on the public attitudes, perceptions and behaviours as they respond to the changing social distancing measures, in particular in that country. As I said at the outset, we're 9 weeks in. There's going to be quite a long way to go, and the support that our teams are providing is changing daily in some cases and weekly as we work to respond to what the governments need most and the questions that they have to tackle on a day-by-day basis.